Now we are going to talk about practice occupational health and safety procedures. At the end of the lesson, you are expected to identify hazards and risks and evaluate and control hazards and risks. Hazards and risks. Hazard and risk are often used interchangeably, but there is a significant and meaningful difference between the two terms. When scientists and policymakers carelessly substitute one for the other, the confusion gets compounded. So what's the difference? Now let's talk about hazard. A hazard means a situation or thing that has the potential to harm a person. Examples: chemicals, electricity, open drawers, inadequate ventilation, and many more. Now what about risk? Risk pertains to the possibility of someone being harmed and an indication of how serious a hazard is. Or in another meaning, a risk is the possibility that harm might occur when exposed to a hazard. Examples: death, injury, or illness. Now let's put it into a situation. Hazard: a hot-tempered supervisor screaming at staff. The possible risk: a mental health issue for a staff member. To be able to understand well about hazards, let's identify the types of hazards. Take a look at the illustrations. Did you experience any of this? This pertains to physical hazards. Physical hazards are factors or conditions within the environment that can harm your health. These imparts on the body and are easy to discover, but are taken for granted because people does not show mindful attention, or maybe they are uninformed. Examples of physical hazards: electrical, noise, spills on floors, tripping, vibration, lighting, heat and cold, or inadequate working space. Now the possible risks or some effects of these are fire, decreased efficiency, annoyance, fall, and many more. Aside from physical hazard, there is also what we call biological hazards. Biological hazards are organic substances that present a threat to the health of people and other living organisms. Examples of biological hazards: blood or body fluids, fungi, bacteria, viruses, or contaminated wastes. The risks are infections, skin irritations, allergy, or even tuberculosis and AIDS. Another type of hazard is chemical hazard. A hazardous chemical can be a solid, liquid, or gas. It can be a pure substance consisting of one ingredient or a mixture of substances. It can harm the health of a person who is exposed to it. Examples of chemical hazards are cleaning products or disinfecting solutions. The risks are lung disease, difficulty in breathing, allergy, dizziness, or loss of consciousness. These illustrations are examples of ergonomic hazards. Ergonomic hazards are physical factors in the environment that may cause musculoskeletal injuries. For your information, your musculoskeletal system includes bones, muscles, tendons, ligaments, and soft tissues. They work together to support your body's weight and help you move. The examples of ergonomic hazard are inappropriate height of workstations, lifting heavy loads, too much twisting and reaching, prolonged standing or sitting, or maybe a static posture, repetitive movements, or an awkward postures. The possible risks are a pain in the shoulders, back injury, numbness in some of your body parts, or a muscle cramp. The last type of hazard that we are going to identify is psychological hazard. Psychological hazards are elements of the work environment, management practices, or organizational practices that pose a risk to mental health and well-being. Example of psychological hazards are burnout, fatigue, on-call duty, unreasonable expectation from patients, verbal abuse from dissatisfied clients, unrealistic performance expectations. The possible risks are sadness, worry, loss of self-reliance, loss of concentration at work, or declining performance at work. One of the most difficult problems for any safety representative is identifying safety and health hazards at work. Basically, how do you know if a chemical in your workplace is toxic, a noise too loud, or a process dangerous? Sometimes, a safety representative, whether it be a worker's representative or a supervisor or manager, may have a feeling that something is wrong, but lack the confidence or knowledge to take up the issue. The first point is that you do not have to be an expert to start identifying problems in your workplace. Your body is the greatest barometer for detecting and recognizing hazards in the workplace. What are the ways to determine health and safety problems? Observe the workplace. Examine complaints from co-workers. Check accident records. Examine chart on results of inspections. Inspect the workplace. And study vital information about the workplace. Now let's talk about evaluating and controlling hazards and risks. Controlling hazards and risks. Occupational health and safety is a campaign and maintenance of safe working environment. This is just an information. Did you know that occupational safety and health standards in the Philippines was created in 1978? This was made to protect the social and economic well-being as well as the physical safety and health of all workers. Before we go further, let's determine what is risk assessment. Risk assessment is focusing on the risks that really matter in the workplace. Records of these assessments should be kept. Let us also determine how to evaluate hazards and risks. Evaluating hazards and risks is the process of determining the level of risks created by a hazard. How do we control these hazards and risks? Selecting an appropriate control is not always easy. It often involves doing a risk assessment to evaluate and prioritize the hazards and risks. In addition, both normal and any potential or unusual situations must be studied. In this manner, Let us study the categories of control measures. The first one is through elimination. This is by means of removing all elements that can be sources of danger. The second one is to substitute, replacing a hazardous agent or work process within a less dangerous one. Third one is engineering control. This is changing a piece of machinery or work process to reduce exposure to hazard. The fourth one is administrative control. This is limitation of working hours. Example of this is job rotation. And the fifth one is using personal protective equipment or PPE. Aside from using PPE, following some safe work practice is also vital. Now let's identify some safe work practices. 1. Implementing safe standard operating procedure. 2. Training employees for emergency situations. 3. Maintaining a good housekeeping program. 4. Maintaining the good condition of equipment. 5. Following hygiene practices and procedures. We also have to deal with practical ways to prevent hazards and a closer look at electricity. Ensure that all electrical equipment you use is in good condition. Ensure that there are no damaged electrical cords. Your hands should be dry before attempting to use any electrical equipment. Do not attempt to change fuses unless you know what you are doing. Do not turn on all appliances at the same time just because you want to save time, for this may cause short circuits. Use of personal protective equipment or PPE. Examples: surgical gown. Your surgical gown should be long enough to cover your clothing. Remember, a wet gown is considered contaminated. Another example is surgical apron. This is used if gown isn't available. Another example is medical mask. Your medical mask should fit comfortably over the nose and mouth. Remember also, wet mask is considered contaminated. And lastly, surgical gloves. This is used when there's a contamination or a caregiver has an open wounds. Another practical way to prevent hazard and risks is through proper disposal of health care waste. Human waste products. Examples: blood and bloody fluids. These must be removed right and flushed down the toilet. Wash contaminated clothes separately using hot water. Also, dressings with blood need to be double bagged in plastic and disposed of based on existing community or local rules. Needles or sharps should be kept in a container which is not easy to pierce and may be kept or discarded right away. Medical equipment. If the equipment is contaminated, discuss with the immediate supervisor as to whether or not the said equipment can be kept or should be disposed of already. And lastly, practice proper hand washing. This is very effective in preventing hazards and risks. This ends our lesson. Now remember, stop and think about the safe way. Safety first!